Imagine yourself 10 years from now. Do you see yourself traveling the world, still in school getting that dream job, or even starting your own family? Now imagine yourself living this amazing life just to find out that it's going to come to an end within a matter of months. This is what happened to a healthy, recently married 29-year-old Brittany Maynard. On January 1st, 2014, Brittany was unexpectedly diagnosed with a form of brain cancer called astrocytoma. Doctors removed 2 portions of her brain, only for the cancer to return in April, this time more aggressively. She soon found out that she was incurable and had an estimated 6 months to live. This was a lot to process, so Brittany began researching her diagnosis along with the treatments. Upon her research, she became a prominent voice in the organization called Compassion and Choices, which supports the debate over physician-assisted suicide. For those of you who don't know what this term means, MedicineNet.com defines it as the voluntary termination of one's own life with the administration of a lethal substance with the direct or indirect assistance of a physician. To further prove why this practice should be up to the patient and not society, I will talk about the physical and emotional effects that are given to the patient when they are denied this right, some legal conflicts, and some cases that have made headlines in recent years. Now, before I get into this, I have to address that some people think this practice is completely wrong. They say that doctors that are supposed to be healers become murderers, and that it just isn't moral. So I have to ask, is it more justified to go against someone's own will just for forcing them to go through months of pain just to, unfortunately, have the same inevitable outcome of death? Which brings me to my first point. What are some of the physical effects that come with cancer or terminal illnesses when they are denied the right to die? Let's look again at Brittany Maynard's case to further see some of the experience that she encountered. Because her tumor was so large, the treatments that they were recommended would make the time that she had left miserable. The radiation would not only singe her hair off, but would leave her with first-degree burns on her scalp. She says that this would ruin the quality of her life. In an interview with ShaAnn, she says, "My question is, who has the right to tell me that I don't deserve this right, that I deserve to go through weeks or months of tremendous amounts of physical and emotional pain?" Not only in Brittany's case, but in many other terminal illness patients, they face physical effects such as fatigue, anorexia, cachexia, nausea, and vomiting, along with emotional effects that include depression, anxiety, and delirium, which can make the physical pain even worse than it already is. On the legal side of this issue, there are some conflicts. According to the U.S. National Library of Medicine, there is a law that states that a person has the legal right to refuse medical treatment. With this law, people, as long as they are capable of communication and conscious decision-making, they can refuse this right in the course of an emergency. So if they have this right in an emergency, why can't they have this right when they are going through months of suffering? Another piece of legislation that conflicts this issue is the DNR. DNR stands for Do Not Resuscitate, and it instructs healthcare providers not to perform CPR if a patient's heart or breathing stops. Many individuals that have the DNR order are people that have terminal illnesses. So why do they have to wait for such a traumatic experience for their wish to be fulfilled? So they not only get to go peacefully, but they don't have the beforehand knowledge that gives them sufficient time to say goodbye to their loved ones. Not only in Brittany's case, but in many others, people share their stories with their fight to die with dignity. Kelly Taylor, a 30-year-old woman from Bristol in the UK, has the disease Eisenmenger's, and along with Klippel-Feil syndrome. These conditions left her with a heart and lung defect, along with a spinal cord disorder that worsened by the year since the age of 7. Kelly spent 6 years facing the courts trying to get the right to die peacefully with the assistance of a physician, until she died in 2012, dying from her illness. Another piece that you may not associate with this issue is the widely popular movie Me Before You. Although it's fictional, it revolves around a man who is recently paralyzed and is faced with the decision of physician-assisted suicide. He goes along to meet the love of his life, but still ends up taking this chance to go with physician-assisted suicide. And although it's fictional, it still shows how important this decision is to people that suffer from terminal illnesses. Not only love can't even change their mind or change the pain that they are going through. This subject is a sensitive issue that isn't often addressed, but it does not mean that it is any less important to bring to attention. The legalization of physician-assisted suicide would not only lessen the pain that people have to go through when they are denied the right, and it would also minimize the legal conflicts that come with it, and it would get rid of any conflicting legal issues that come with